When people think about healthcare, they picture hospitals. Picture the doctors in the white coats, the nurses, the equipment. But some of the most important people in Nigeria's health system right now are not even the doctors. They don't work in the hospitals. Some of them don't even get paid salaries. They are community health workers. Volunteers. Mothers trained on a Tuesday who went back to their neighborhood to save children by the end of the week. In 2025, they are majorly responsible for the outcomes that made it to the UNICEF's annual report, without most people even knowing their names. Hi, I am SAG Nutritionist, and this is episode 99 of Oh My God. Let me give you some numbers as usual. Okay, over 5,600 community health workers were trained in 2025 to strengthen outreach in rural and underserved areas. Their job was to find the children who weren't being reached, detect illness early, and get families to care before it was too late. We'll talk about the 217,000 mothers in Borno and Yobe who were trained to use WAC tips to diagnose malnutrition in their children. And this led to a measurable decline in malnutrition rates in both states. But then we also have the mobilizers. 61,500 of them went from house to house even before vaccination campaigns, talking to caregivers, answering questions, addressing the fears. They didn't have a megaphone or a flyer. It was all just a conversation that happened at somebody's door. And then when families still didn't come out, over 64,000 World Development Committee members were deployed specifically to resolve non-compliance, to go back, to knock again, to find out why. Not just one visit, there were follow-ups, there were persistence, there was presence. In Adamawa State, both the conflict-affected areas and remote areas, 20 keke ambulances were introduced, one per health facility. Because getting a sick child or a woman in labor to emergency care was sometimes the difference between life and death. These kekes facilitated 49 emergency referrals in a few months, and skilled bed deliveries in that area rose 55% from the year before. We talk about health systems like buildings and budgets and policy, and yes, those matter like mad. But the last mile, the actual moment where a child either gets help or doesn't, almost always involves a person. A community health worker who showed up at work, a mother who learned something and used it, a mobilizer who knocked twice, or the keke driver who drove to and fro at night. These are some of the people keeping children alive in Nigeria right now, and most of us have never heard of them. Now that is the end of episode 99. See you next week, same time, same place. Bye.